Good afternoon again. Welcome to this virtual town hall, Faith, Reason, and the Law during COVID-19. Questions, answers, and guidelines. Before we get started, I want to take a few moments to acknowledge that our country is going through a very difficult time, and we want to acknowledge what we see on the news. The reports we see on the news, they tell a small portion of the story and maybe not as accurate as we need it to be. But the killing of George Floyd has broken open festering wounds in the Black community, and now more than ever we need to hear from faith leaders to provide us healing, hope, and help. What we are experiencing exacerbates and complicates our dialogue today. And due to the pandemic, faith leaders who want to and need to be with their communities have this additional layer in their decision to how to resume and whether to resume physical gatherings. The pandemic and the need for social distancing has breached the rhythm and important lines of communication that is gives faith leaders the opportunity to hold hands and to put a hand of healing and restorative sense of closeness on the hands and on the hearts and on the shoulders of those who are very angry and who need comfort. And so we begin today with a moment of silence for the many, over 102,000 who have died from COVID-19, as well as for George Floyd, for Ahmaud Arbery, for Breonna Taylor, and for all the others who have been unjustly, unfairly killed, murdered, and dehumanized by our systems. And so let's take a moment for silence and for all of those, as well as for peace in our streets. Thank you. I want to start our session today introducing our panelists, and thank you and welcome to everyone who is here this afternoon for this very important, critical conversation. On our panel today, we have Maggie Garrett, Esquire, Vice President of Public Policy for Americans United for Separation of Church and State. We have Dr. Robert C. Hill, PAC, local medical examiner for the Office of Chief Medical Examiner here in our metropolitan Richmond area. We have also Dr. Sabrina E. Dent, Senior Faith Advisor for Americans United for Separation of Church and State. And we will start our discussion today with a question that is for everyone. Well, actually, I'm going to start allowing the panelists to say a few words, and we can start with Sabrina, and we'll go to Robert and then to Maggie, and then we will open with questions, if that will work for you.
Yes. Good evening or good afternoon, everyone. First of all, I would like to thank Dr. Harris and the Center for Faith, Leadership, and Public Life at the St. DeWitt Proctor School of Theology for inviting us to be a part of this conversation and partner with Americans United for Separation of Church and State on this important dialogue. As you mentioned, I'm Sabrina Dent, and I serve as the Senior Faith Advisor for Americans United And so I enter into this conversation just to share a little bit of background about Americans United. We are a nonpartisan education and advocacy organization that was founded in 1947 by religious leaders whose primary focus was to defend the separation of church and state. And so it's important that individuals recognize that Americans United is comprised of many different people from many different backgrounds, lawyers, lobbyists, activists, religious and non-religious leaders, and citizens whose advocacy efforts ensure that religion not only dictates, ensure that religion should not dictate public policy, and that the government should not tell Americans what they should believe or how they should practice, whether they have a religion or not. And it also is to affirm that discrimination is not justified under the guise of religion. And so in the work that I do at Americans United, as the senior faith advisor, a big part of my job is faith organizing and outreach, that is working to mobilize religious and non-religious communities on church-state issues that impact all of us, and also working with a faith advisory council comprised of people from many different religious traditions and none. But I entered this conversation because I got my start doing religious freedom work as a BJC fellow in 2015, where I saw there was a need to talk about the intersection of these issues as it pertains to racial and religious minorities when we're talking about religious freedom. So thank you for having me today.
Well, thank you, Dr. Dent and Dr. Harris, for also allowing me to be a part of this conversation and discussion, and Dr. Garrett also for allowing me to share the panel with you all. I look forward to bringing not only the medical perspective, but also a perspective of an associate minister at a small Baptist church right here in Richmond, and also as one of our local healthcare workers on the front lines of COVID-19 and actually working inside of the hospital and dealing from the medical and health aspects. So I look forward to a robust conversation with all of you.
Thank you.
Sorry, I thought I mastered the unmuting, but I didn't. I also want to thank all of you for having me. And I want to begin by also acknowledging what a difficult week this has been. We've surpassed 100,000 deaths due to COVID-19, and the recent killings of Black men and women at the hands of the police around the country has filled us all with grief and anger. And I'm sure that it's been an incredibly traumatic and emotionally draining week for so many of you. And so I especially want to thank you for joining the webinar today and for having me here today. And also, like Dr. Harris, I want to acknowledge that it's in times like these that many people seek comfort in their faith community, whether by going to services or gatherings simply to be together. And yet science is telling us that doing that is dangerous because COVID-19 is highly contagious and it's a deadly virus that could, kill your congregants and their families and their communities. That's why governors across the country have temporarily banned mass gatherings, even at places of worship. And I'm here to support those restrictions. And so I just want you to know that I understand that abiding by those restrictions is incredibly hard for many of you on the webinar today. My role at Americans United is as a lawyer and a lobbyist. I run our policy department, which consists of 5 people, 4 lawyers and an assistant who might as well be a lawyer. And we advocate for good church-state policies at the federal and state levels. That means that my day-to-day work is being in touch with members of Congress and their staff. We have to spot issues in bills. We write letters, we do analysis, we get people riled up to speak out. We offer amendments, we draft talking points, all of those things. And at the moment, the most of our time is spent fighting back against the Trump administration that is pushing policies that misuse religious freedom to allow discrimination against other people, which I know Sabrina is going to talk about. I'm not a faith leader, though I do come from a faith tradition. I'm a Lutheran, the ELCA kind, not the Missouri Synod kind. And it is actually true that my Republican father and my Lutheran pastor are responsible for my views on church-state separation. They actually inspired the work that I do today, and I was taught pretty young that actually church-state separation was a conservative and a pro-religious concept. Pastor Assoc taught me that to have religious freedom, you must have church-state separation. that it means little to have church-state separation or to have religious freedom if the government can pressure you to adopt different beliefs and practices by giving preferences to certain religions. Church-state separation means that houses of worship are protected from interference from and entanglement with the government, and church-state separation means that faiths aren't given preferences that allow the government to impose their views on you. My first job out of law school was actually at Americans United. I left to go work at the ACLU of Alabama and the ACLU of Georgia, where I did many issues ranging from immigration law to voting rights to, everything. But I just kept coming back to church-state separation issues because I think it's intellectually stimulating and sort of at the core of who we are. And so that's how I come to you today.
Dr. Harris, I think you're muted again.
Great, at some point. Okay, so let me just say thank you all for your introductions, and let me introduce a little bit more about the Johnson A. Edsomwan Center for Faith Leadership and Public Life. I am the director, Faith Harris, and it is a initiative we started and launched about 2 years ago. It's here at the DeWitt Proctor School of Theology at Virginia University. It is dedicated to the faithful formation of globally minded public leaders committed to community well-being, healthy congregation, social justice, and environmental sustainability. It is grounded in the rich religious traditions and practices of African and African diaspora communities. The center collaborates with community and university partners in advancing a broad and inclusive ethic of freedom and justice for all of God's creation. And the center convenes conferences, forums, lectures, public conversations, and symposia, in providing a unique space to engage some of the most pressing ecumenical and public policy issues confronting the church and our society. The center promotes research and practices on new and innovative models of theological education that bridge seminary, church, and society. And we're just very delighted today to be able to bring this conversation to you. And we're just so thankful for the 24 or so participants we have. And we just hope that as we progress, that some of your, in our conversation, that your questions will be answered. And then at the end of this, at the end of our discussion, we'll be able to answer further questions. You'll be able to put them in the chat and answer questions, and we'll be able to answer your questions. So let's start off with some of our guiding questions that we have prepared. Tell us, and this question is to everyone or anyone who wants to respond of our panel. Tell us about you. Well, most of you have already told us a little bit about your work. So what about this one? Actually, we've already covered that question. So let's go to Sabrina for the first question. What is religious freedom, and why is it even more critical for faith leaders to be engaged in these discussions now? We hear people sometimes questioning whether we need to be concerned about it, particularly in the African American community. Why should we care about religious freedom? What is it? Give us some understanding here for that.
Dr. Harris, I'm actually glad that you asked that question. As someone who comes from a Pentecostal foundation, I grew up in a Pentecostal household, and also I've been a part of the Baptist tradition. At one point, I was a part of the Catholic tradition because I was married to a Catholic at one point, and I've been a part of other religious communities and an interfaith leader. I think it's important that religious leaders and non-religious leaders understand that religious freedom is a constitutionally guaranteed right for people of all religions and none. But it's not just that. Religious freedom is also a human right, and it's a social justice issue as well. I really believe that one cannot deeply engage in the work of religious freedom without looking at all of these. So constitutionally speaking, the freedom of religion is the first of our freedoms guaranteed by the First Amendment. The first 16 words of the Constitution states that Congress shall make no law respecting an establishment of religion, nor prohibiting the free exercise thereof. These words basically affirm the two clauses that are in the First Amendment, which are the Establishment Clause, which affirms that there cannot be any government or state-sanctioned religion, and thereby the government cannot show preference to any particular religious group over another, including non-religious groups, and that everyone must be treated fairly. It also highlights the free exercise clause that provides that people have the right to choose or change their religious beliefs without government interference or even discrimination. So this is the framework that we use in the United States, and this is what our work stems from at Americans United also. But there's also this right that is on a global level that is outlined in the Universal Declaration of Human Rights, which basically states and affirms that people have the right to practice their beliefs as they choose, or if they choose not to have a religion, they have that right to their freedom of conscience, and that right should be exercised, again, without discrimination. So why is this important as far as religious leaders is concerned is that at the same time, we have to think about this. With religious freedom comes the rights, but also the responsibilities. And so that is the responsibility to guard that right for everyone. So whether someone has a religious identity or not, they have the constitutional right to exercise their beliefs however they choose to do so. And so we must guard that. If I'm a person that identifies a part of the Christian tradition, right? I don't want the government telling me how I should worship. I don't want the government telling me when I should worship. I should also respect those same things, and so the same wishes and those same rights for people from other religious traditions and none. At the same time, we have to understand that religious freedom intersects many issues, and Maggie will go into this a bit more, but religious freedom also impacts, like, in terms of right now, unfortunately, religious freedom has been used to discriminate people from the LGBTQIA community, as well as other religious traditions, religious minorities, and we have to speak up about that. But it also intersects when we're talking about reproductive justice, when we're talking about prioritizing public schools. Also, when you're looking at elections and you're talking about keeping houses of worship free from political influence. There are so many ways in which religious freedom intersects our daily lives, and so religious leaders have to be engaged in these conversations, especially when we're talking about this critical moment even of social justice. So that's one of the reasons. So you have to remember there is the Establishment Clause and there's the Free Exercise Clause, that the government should not intervene, and that we have rights and responsibilities. At the same time, your right to practice religious freedom should not mean discrimination against someone else.
Thank you, Sabrina. That was thorough and very very helpful in helping us frame why we're having this conversation. Why do we need to be concerned about this? I'm not sure that we often daily think about our rights in that full-throated, complete way, and it's so important that you have kind of anchored that the discussion for us that way. Maggie, all 50 states are in some state of reopening. So we've had a closure of many of our states, but all 50 states are now reopening and issuing guidelines for businesses and houses of worship, as well as educational institutions. What should religious leaders know and understand about these government guidelines on gatherings? And what legal liabilities or considerations should faith leaders consider when making their decisions about opening? what are the liabilities? Are there legal concerns and decisions that faith leaders need to be considering before they make these decisions to resume? It's not reopening. We want to really frame it as, because we have faith leaders and churches and houses of worship, whether they are Christian or not, have not really closed. They have been doing virtual and finding other ways to meet the needs of their congregations. But what is, we want to call it, I think, physical resuming or gathering together in physical space. So tell us, what are some of the legal concerns that faith leaders need to be thinking about?
Sure. So first, I want to talk a little bit about the way the state executive orders work. I think there's been a lot of confusion around what's a mass gathering, what's essential, how do they work together? Are you saying that my church isn't essential, and how they work and how they fit in with constitutional requirements. So there are actually two main layers to the executive orders that you're seeing across the country. The top layer is a temporary ban on mass gatherings. And then under that, they have the closing of non-essential businesses and activities. So for the mass gatherings, which is where AU has been focused, the CDC tells us that large events and mass gatherings can contribute to the spread of COVID-19. And so governors across the country have temporarily banned both secular and mass gatherings, including large community events, sporting events, concerts, religious services. And it's important to acknowledge that COVID-19 does not discriminate. It's just as likely to spread at houses of worship as it is at other secular mass gatherings. And so our governors across the country have applied these temporary bans to protect people. As is already said, it's not closing churches, it's just preventing physical gatherings. A few states had no bans. Some states, most of the states actually had mass gathering bans that applied to equally to secular and religious gatherings. Some states actually exempted religious gatherings from the mass gathering bans, which we think is unconstitutional because it gives a preference to religious gatherings over similar secular gatherings. So it's preferring religious people to non-religious or even activities, but also because the Constitution prohibits the government from granting religious exemptions that harm other people. It is hard to say that a religious exemption in this case doesn't risk harming others when it is the spread of a deadly virus. Now states are increasing the numbers that people can gather in. Went all the way down to 5, they're moving up to 10, 100, 250, depending on where you are. Other states are doing things like Virginia, which is, instead of having a cap on the number that all churches can have, they're actually looking at the occupancy capacity of the church. And then adding specific social distancing measures. Virginia's rules, I was skimming through them before this, are pretty elaborate and actually quite good. The other level of restriction is about the non-essential businesses. And so it shuts down non-essential businesses and then has a list of essential businesses that are allowed to remain open. This is like hospitals, daycare centers for healthcare workers, supermarkets, pharmacies. They vary from state to state. Many allow liquor stores to remain open. I've frequently heard, how come I can go to the liquor store and I can't go to church? And there's a reason for that, in addition to the fact that closing liquor stores would create another health crisis, which is people who have addictions suddenly having withdrawal, which would then, place another public health crisis on all of us, and overwhelm hospitals and create lots of dangers. Essential businesses are different from mass gatherings, right? Like when you go to the grocery store, you go at different times, you walk around as an individual, you interact only when you're making a purchase, or if that one person won't get out of the cereal aisle when you are trying to pass them. But religious services are a communal experience where there's large groups of people, they come together, you are singing, you are passing things, it is communal and different. And so most states are designating houses of worship as essential so they can remain open to do things like virtual services, small funerals, gatherings, their essential work, but they still have to adhere to the mass gathering rule. So people who say that they aren't treating churches as essential is not true. So we've seen more than 30 lawsuits challenging mass gathering rules as applied to houses of worship. And the claim is that the First Amendment prohibits governors from applying mass gathering restrictions to houses of worship, regardless of the public health risk, and even if they're being treated the same as secular gatherings. So far, more than 20 courts, including as of Friday night at midnight, the US Supreme Court, have rejected these arguments. Courts have repeatedly held that orders that ban both secular and religious mass gatherings alike are constitutional because they don't target religious services. They've also recognized that governors have a compelling interest in enforcing the bans to protect health. And the only way to meet these, the only way to protect public health is to ban the mass gatherings. There's really no other way to do it. So as you're thinking about what to do, what do I think as someone who actually only does church state law and not tort law? So check your lawyers first. But essentially what the law will tell you is that you have to act reasonably if you're worried about lawsuits. So what does that mean? It means to follow your state laws and your state guidance. A lot of insurance companies, including Church Mutual, which I guess insures a lot of churches, they have instructions on things to do and how to avoid lawsuits. And another reason you might want to go to your insurance company is one of the churches that continue to have mass gatherings at the height of the COVID outbreak actually lost his insurance. The church lost their insurance, which is why he eventually shut down his mass gathering. So I think that that is the way to go. And then of course, go to medical professionals who know more than the lawyers.
Well, I definitely think from the medical perspective, you know, as far as reopening of churches, we definitely need to consider the legalistic and legal requirements. You know, although we want to get back to, you know, our worshiping and our worship centers, we still can't forget that medically, you know, this disease, this pandemic still has no cure. There is no medication that can cure it, although there are several that are touted in many emergency situations as possibly bringing forth, you know, a rapid decline in the disease or the virus progression. It still is not a cure, and there is no vaccine. So that's what I think ultimately too must also be considered as we contemplate opening, you know, our faith organizations and faith places of worship.
Robert, may I also ask you to, recently I heard reports and listened to some scientist, one out of Minnesota, I think his name was Osborne. I'm not sure, I'm not pronouncing his name correctly, I'm sure. But he suggested that there were also concerns that around even wearing masks. And his focus is how aerosols work, and that what he suggested and said that the reality is that even with a mask on, after about 4 minutes, you have expelled so much aerosols from the sides of the masks, unless you're wearing one of those, you know, respirator masks, that you have filled a closed room with enough contaminants, contagion of COVID-19, if someone is present with it, for others to catch it. When we think about the things we do in mass gatherings in worship, we sing, we pray out loud, we hug, we touch, we do all those.
That's the plate.
Yeah, so I would like for you to speak to that a little bit as well.
Well, although I am not an expert in infectious disease, my background and training as a physician assistant is very broad in medicine and in surgery. And I currently work in orthopedics for bones and joints. But the population that I see every day is the elderly who come in for their total hip and knees, and the very young who come in after they've broken their arm from playing on, you know, a monkey bar. Well, lately it's just been playing around the house. So, you know, as far as masks and their effectiveness, he's right. I mean, in very, you know, inside of the hospital, if a patient has tuberculosis, let's say, a very known and well-documented, you know, respiratory infection, that infection, that patient is put inside of a negative pressure room, and we wear things like respirators and things like that to interact with them. This disease is kind of tricky because it not only is spread by aerosolized particles, but it's also spread by contact. So you touching something that is infected and then touching yourself or your face or other areas that then, you know, get either placed around your mucous membranes, your eyes, your mouth, your nose, and that can also lead to infection. But there's still a lot we don't know about this disease, and there's still not a lot we don't know about this virus. However, I think that masks of any concept or any design are still going to decrease the rate of transmission because those aerosolized particles will most likely not end up inside of your mucous membranes in your mouth, your nose, or around your eyes. And so that's what we're trying to prevent. Mm-hmm. As far as, you know, do we need respirators or can we just have a bandana around our mouth? I think what the CDC is really trying to bring forth and what a lot of municipalities inside of our states and inside of America are trying to do is to create a mitigation plan through a mask of some type to try to stop the spread of disease. But it still requires hand washing. It still requires social distancing. It still requires that if you know you're sick, to keep yourself out of the population and to quarantine yourself for up to 14 to 22 days. So those are things that we still must consider as we go back into, you know, our worship communities and into, you know, our houses of worship as well, because it's kind of hard to clean an entire church or facility after one group is just left for the next group in a timely fashion. You know, it takes time, it takes planning, and it also takes, you know, kind of the ability to have mitigation points like we're doing currently in hospitals. We're stopping everyone at the door and we're checking their temperature. And so churches, if they're going to become a new place of gathering, I think those are going to be some of the policies and some of the new normals we're going to have to implement. We're going to have to implement, you know, testing of temperatures, questioning on symptoms, and then also social distancing inside of the congregation. So this sounds easy, but it's fairly hard for smaller churches, you know, churches that may have congregations of less than 200 people versus those who may have thousands of people. So each one will kind of bring new situations that need to be addressed and need to be tackled in different ways. But the CDC has done very, very extensive work and a great job, I feel, in giving recommendations for churches to open, just as they've given recommendations for our states to open, which may or may not have been fully taken into consideration. But I think those are where our churches should start, with CDC guidelines. Okay. And, you know, not just kind of going off of the general feeling of the populace, in my opinion.
Thank you. So you are recommending that churches use the guidelines, make themselves aware, acquire the guidelines, make themselves aware and familiar with the guidelines, as well as taking into consideration their own specific needs, depending on their, you know, their congregations.
I definitely recommend that because, you know, as well, Dr. Harris, that we've had, you know, several faith leaders, well, one faith leader who actually succumbed to the coronavirus, who did not social distance, who kind of avoided that. And it's such a double-edged sword, because on the one hand, we walk the hand of statistics and what we know about medicine, but then on the other, we walk the side of faith. And so I think there's a medium that can come in the middle in which we can still come together, but yet with the right plan in place, with the right mask and proper attire, PPE, with hand sanitization and, you know, Purell or something inside of our gatherings, and limiting some of our contact. Now, although that is completely the antithesis of what church is. Church is a unifying place. Yeah. And now we're kind of asking people to not or abstain from that unity.
Yeah. Well, one of the things Dr. Ulsterholm, I'm pronouncing his name correctly now, suggested also is that gatherings outside are much more safe. And so we know that as we are now in the warmer seasons and we have spring and summer coming, we know that we could probably think about some creative ways, and that houses of worship and faith leaders should be considering some creative ways where they can, gather maybe in parking lots or whatever, but have it outside until we fully are able to implement some of these guidelines, because the CDC guidelines are extensive and will require really some serious rethinking and decision making for leaders and for deacons and leadership boards of congregations, whatever faith tradition they may come from. So thank you so much for those smart and thoughtful words. Sabrina, you want to add?
Yes, I do want to add, I do want to acknowledge that there are religious leaders that are in this moment that have taken the CDC guidelines very seriously. We know earlier on, there were a lot of reports about some of the atrocities or casualties that were happening as far as the Church of God in Christ, right? And then Bishop Blake then made a public announcement to basically say that they would suspend their annual gathering, and that also they will follow the CDC guidelines. And so you have religious leaders that are taking this moment very seriously. Also, just recently, there was a video that was released by religious leaders from many different traditions down in Tennessee, again, saying that we can still be together but apart, right? We have to reimagine what we consider to be sacred space. And so that's one of the things that come up for me in this conversation as someone that is an interfaith leader and that works with people from many religious traditions and none, is like us reimagining what we consider to be sacred, right? So I don't invite just anyone to come into my home, right? But so one of the things I think about with that is that I consider my space here at home to be sacred space. Now, right now, for the sake of this webinar, people have the pleasure of seeing my backdrop because virtual backgrounds don't work for everyone. But I think that it's important that we think about these things. Also, to highlight the fact that it has been brought out that a lot of these cases came about because of people gathering in houses of worship and not following some of the guidelines earlier on. I know at Americans United, that Maggie and the team that she works with have an exhaustive list of cases around the country that have resulted because of people not social distancing and not taking these guidelines into consideration. And so one of the things that we're seeing is we're now hearing people push back. There were cases, parishioners pushed back against what the Catholic Church was saying about gathering. There were cases, even in the form of an op-ed that was written recently by someone that basically said like that she believed that this moment of us social distancing is actually a way of exercising how we show love for our neighbor. So again, it's about reimagining how we're thinking about this moment in time and recognizing again that it has impacted many groups. About 2 weeks ago, I had the pleasure of hearing my colleague, Rob Boston, who's the editor of our magazine, Church and State, speak to a group of non-religious, secular atheists and humanists and their assembly called Sunday Assembly. They gathered on Zoom to really talk about their concerns and the ways in which they choose to care for community right now. And one of the things, just like we're doing in this call, is they had a medical professional, a nurse that has been on the front lines that actually said why we should think more deeply about this moment and reimagine, how we can hold each other together in care, but at a distance, right? And so it is important that we follow the CDC guidelines. It's important that we understand what Maggie is talking about in terms of the policies and understand that what the Supreme Court did on Friday night was a big win for us to think about in terms of public health and public safety, because that is something that we do not, I don't think any religious leader or religious community at the end of the day wants to be held responsible for deaths and from their congregation. And so I think it's really important that we think about this, but also raise awareness about the many different religious traditions and communities that have reimagined this moment. And so whether it was how people had to reimagine Passover, or how they had to reimagine Ramadan and having virtual iftars versus being in person, or what does it mean to reimagine having your Friday prayers if you're a Muslim. So those are things that we have to think about. Again, that, as Maggie talked about, this has been applied to religious and non-religious spaces. And so we have to remember that all of us are in this together, and recognize that it is important that we take seriously the guidelines, because science is showing us something that's bigger than us, right? Yeah. It's really bigger than us, and we have to be responsible, and we have a moral responsibility to respond to that safely.
Yeah, and I think,
we still, although we're in the midst of a pandemic and also some social injustice and social upheaval in some aspects in some cities, there's still many health concerns that the church can play a big part in, from hypertension, which kills 300,000 Americans every year, to diabetes and strokes. There's still many other things that can be brought forth, from the faith community, because it's still a great platform, I feel, in which to reach the masses and to reach all people.
Well, I want to just, before we go on to our next question, I just want to, the thought occurred to me just recently actually when the order in Virginia was lifted. My question, and I'm sure many others have had this question, what has changed? What's changed? Do we have mass testing where people who think or suspect that they've been exposed are able to be, sorry, please apologize, are able to get a test quickly and immediately and have results returned quickly? Do we have a treatment that is, viable and that is actually healing people? Do we have a vaccine? There really has been no meaningful change. We were ordered to stay at home to flatten the curve, and we complied. But in reality, there are really no meaningful scientific medical changes that would make it any different for us to think that we should gather again without concern, without recognizing we are still at great risk. And so I just think that we all need to be thinking of that. And it was very surprising, actually, and thank you, Maggie, for sharing. And this question is going to come to you as well. But just the reality that pastors and faith leaders and people who are responsible for the fiduciary health of their house, of their buildings, and of their policies, and all of those things that the insurance policies are actually threatening and following through with canceling policies for people who are not making these decisions, based on science and based on, the wisest and best information. Also, this question is for you, Maggie. During this moment, it's easy to be consumed, and I think it dovetails right into what we were just talking about. Many faith leaders are consumed with the realities of COVID-19, public safety, but they're also thinking about sustaining the financial, health and wherewithal of their houses of worship and taking care of the needs of the community at the same time. And last week, the president demanded that states reopen places of worship, and also threatened to order them himself. Can you speak more about this issue to us and help us understand not only the the risks, but also the law? I know you've already raised the issue and shared with us what the Supreme Court did, but just kind of dig in a little bit deeper so people are sure that they understand how what religious freedom means in this context.
Sure. So first, I think you're referring to Trump last
Yes.
Friday. He, in a press conference, said that if the governors don't lift their temporary bans on mass gatherings immediately, he, quote, will override the governors. And, I think it's first important to understand that he lacks the power to do that totally. The 10th Amendment of the United States Constitution leaves decisions like this to the states and to the governors, and the president cannot override them. Even if he could override them, he didn't actually issue any sort of an order. He just stood up at the podium and said, like, I will do this. And like, there's nothing in writing, there's nothing official. So he is not able and has not overridden the governors. But what he did was what he's been doing a lot, which is he's saying things like this to appease his white conservative evangelical base. And he is putting politics above public safety. And he is unfortunately causing confusion. He is emboldening people to disobey their state governors. He is putting people's lives at risk. He is undermining trust in scientists. And it just, overall creating, I think, a lot of problems. And, he says these things and he doesn't really follow through with them because he knows that he can't. One thing I think that faith leaders could actually do in situations like this is speak out in support of their governors and speak out against actions like this from Trump. I think governors often feel very alone in these scenarios that is presented as them being anti-faith, because the other side is so loud, and the voices on this side, or I shouldn't assume which side people are on, but on the side I would advocate for, are not as loud. I think they're often trying, maybe they're not picked up by the media as much. It makes not as good of a story, but I would encourage you to support your governors who often sometimes cave in these scenarios. Even a lot of these lawsuits, these governors have won and they have still changed the law out of fear of an appeal or something else. So they're winning and yet still changing the law, which endangers people in houses of worship rather than protects them. But it's not the only area where Trump is using the pandemic to push his political agenda. He is moving forward with adopting regulations that make it easier for religious organizations that provide government-funded social services to insert religion into their programs. So at a time when people are losing their jobs, more people need social services, he is moving along in the process of making it easier for certain religions to get money to provide these social services and then take away the religious freedom rights of people who attend them. For example, the Obama administration said if you went to a social service provider that was religious and you felt uncomfortable there, imagine you're a LGBTQ teen who is homeless because your parents kicked you out because you're gay. The only social service provider who is there is religious, and you know that they also think the same way as your parents, and that is your only option. Under the Obama administration, you could say, I don't feel comfortable with this. Can you please send me somewhere else where I know they are not judging me. Under the Trump administration rules that they're pushing forward and moving forward as we speak, the provider wouldn't be required to give you an alternative provider at all, and you wouldn't even be told that you could find one. They would just say, 17-year-old kid, go find one on your own. You can figure it out. He's finalizing rules that allow healthcare workers to discriminate against who they serve, particularly LGBTQ people. And then Betsy DeVos has been, I think this is the most egregious. The first emergency relief bill gave a lot of money for public schools, made clear that it was for public schools. And there's some provisions that allow money to go to low-income students who attend private schools, but it is attached to students who are low income. And she has been pushing policies that takes money that was particularly there for public schools and pushing it to private religious schools. And the money that was designated for low-income kids, even those who go to private schools. She has erased the low-income portion, and now it can just go to all kids who go to private schools, which means that, you know, rich families like Trump's kid going to a private school, his child could get money attached to him as wealthy as he is, as someone who is low income is, and that reduces the funds that go to low income kids. And asked if she was point blank asked, are you taking advantage of the pandemic to push your political agenda of private school vouchers? And she responded, absolutely. So this is helping in a lot of ways, because there's so many issues to follow, right? Like, even I only work on church state issues. I know as faith leaders, you are responsible for way many more issues than I am responsible for taking care of your communities. I feel very overwhelmed. And so I think that they are taking advantage in many ways of so many issues happening to push through things that they know wouldn't be popular.
Is there a place that we can go, or if we want to find out more about the law and how to help people who may be caught in that gap during this time, you know, for legal understanding and assistance?
Are you thinking of like direct assistance, or are you thinking politically how to speak out?
So for, you know, as an inpatient, I work inside of a hospital, which we call inpatient. So for us, turning away someone based on their, you know, preference or discriminating against them based on race or ethnicity is completely unallowed because of the EMTALA Act. I mean, the law says we have to. So if for private practice, though, I don't think that's the same. And I think that's where you were speaking. So how will people, you know, or what could be the legal ramification? Medically, there are multiple free clinics in places like Richmond, inside of Virginia, in order to go and get healthcare, to get treatment, and to get tested for COVID. The Virginia Department of Health is also providing that testing if you can't get it from your local hospital or from your own primary care physician because you may not have insurance. But what are kind of the legal, I guess, ramifications?
Yeah, so
I just want to understand.
Yeah, it's a great question, and it's very complicated because different rules apply. Like you said, if you get federal funding, some rules will apply. If you don't, other rules apply. There's two different rules that allow discrimination. Actually, AU in one of our lawsuits blocked one of them. It was essentially, if you get any federal funding, anyone in the healthcare arena. So if you are someone who takes, if you're the receptionist and you call for a service that the receptionist says that violates my religious freedom, I don't really like that service, they could just like not take your appointment, and they couldn't be fired for that. The government will prevent them from being fired for that. So no action taken against them. You could be a nurse who refused to serve someone who had an ectopic pregnancy and needed an abortion in order for her fallopian tubes not to explode. You could just say, I'm not doing it, and there would be you couldn't do anything about it. We blocked that in Congress, or in the courts. So that's blocked now. I would say if someone comes to you and says that they have been turned away for religious reasons, come to us. We have a team of 9 lawyers, I think it is. We obviously don't love seeing these things, but we would be happy to bring a lawsuit and try to not just help that person, but change the whole system.
Thank you for what you do.
Yeah, that's very helpful information. Thank you for Robert. Just kind of thinking about the situation that we're in right now, where we have hundreds of people in the streets in major cities. There is some social distancing going on. There are some people are wearing masks, but I just wonder what your thoughts are as a medical professional, what you would like for faith leaders to, because I know there are many faith leaders who, one, probably feel compelled to be there to try to quell some of the violence, but as well as to offer comfort and healing. And to offer words of prophetic wisdom. I just would like to hear from you as a medical professional what you would want to say to not only faith leaders, but to some of the people who might be out there trying to, for a very just cause, right? For very just reasons, for everyone understands why they're there. But what do you have that you would want to offer?
Well, I definitely still have to offer, the fact that we're out there protesting is our right as Americans. And I think that right should not be taken away. We have the ability to speak against any type of injustice or injustice. And so I do think that that is their right to do that. But I think there is still a need to remain safe. I think there is still a need to, I saw some people who definitely weren't practicing social distancing and they weren't even wearing masks. Others were wearing masks inappropriately. So if the mask isn't covering your mouth or in your nose, you're not wearing it appropriately. So you're still spreading the virus. And what we found is that 20 to 32% of, people infected could have no symptoms. So, even on this call, one of us may be asymptomatic without symptoms, no fever, no cough, no shortness of breath, no upper respiratory symptoms, and could still pass that virus along. So I think we still have to exercise caution in that. And I think that we still have to remember that although we want to speak our truth, and although we want to be out there in the midst showing that there was injustice, and I agree, that this is something to definitely stand up for and stand up against. We still have to remember that the virus does not wait on political indifference or injustice. The virus will infect and do what it does. That's its life cycle. So I think we still need to remember that although we are in, a very socially turbulent time, that, these requirements that the CDC has set forth, that our states have set forth, and then what we need right now, as far as, speaking our truth, still needs to be, still has to have the underpinnings of, safety for yourselves and for your families, because everyone who's out riding, right now still goes back somewhere and goes back with someone that they love. And it would be a very bad end to have, such a unjust thing happen and protests happen and then to come home and to infect someone that you love. But I think what we as faith leaders and in the faith community must also do is recognize that wherever there is injustice, there will always be a need for someone to speak out against that justice. And I think there are many ways that it can be done. It is not just looting in the streets that it has to be done. It can be done peacefully. It can be done with the power of the pen. It could be done by changing laws, by putting forth new laws. It can be done by not supporting businesses that don't support the things that we believe in. And I think we forget the power of economics, which also is a part of it. But in all things, we must find unity, because no matter the differences that we may have, we are all still human. We all still need food, shelter, and love. And so we all need to come together to find that peace. And I think right now, there needs to be healing, and maybe that will come from justice inside of the Minneapolis courts. But if whether it does or it doesn't, there's still a pandemic going on, and we can't forget that either.
Yeah. I read a post of a colleague, a friend, recently, and what she talked about was just the grief that she's experiencing because of this addition, being in the middle of a pandemic, and to have this as another layer to the pandemic, right? To not be able to reach out and touch friends and to hold one another, and to be in a room to at least find cathartic release for the pain that so many in the African American community are feeling because of watching, death by police officer and the killing of George Floyd. And I think, I think for many who are in the streets, they have forgotten that we're still in the middle of a pandemic.
I think we also need to remember that mental health and those who are affected by mental health because of the pandemic have also lost a lot of the services which Ms. Garrett, Dr. Garrett spoke of that they could go to and reach out and kind of be helped and find shelter in that. And now they're relying on the hospitals, they're relying on, you know, anyone or any opportunity to get out there and to be helped and heard. And I think, you know, what I've seen as a medical examiner is we've had a higher instance, and this is just anecdotally, of overdoses. I can't tell you how many people have overdosed lately from some of the cases that I've been seeing. So, you know, everyone is trying to find a way to find healing. And I think we need to come up with some great alternatives. And I think the faith community can lead with that, whether it's through meditation, prayer, fasting. There's so many other venues that those types of ailments, you know, the mind can also be find satiety.
Mm-hmm.
Robert, to your point, I co-signed what you're saying. One of the things that you talked about is the many ways in which we can protest, the many ways in which we can show up and we can speak out, especially when we reflect on the fact that we're in the midst of a pandemic of this happening. So whether it's through an op-ed or like this afternoon, I know that the Untitled Center out in Dulles, which is the area Dulles, is a Muslim organization that is hosting an interfaith rally via online for people to join and to really speak out about what is happening right now as far as the atrocities that center around like Black lives and people of color. And so it's important that people are finding, again, creative ways in which they can speak out and take a stand and be vocal about it. I know personally, one of the things that I did the other day was I wrote an op-ed because I think when we think about what is happening right now, whether it's about the church-state issues that impact us, the ways in which we cannot gather, or just thinking about like overall the results or the impact of COVID-19 on our communities, right? I personally know 3 people that have died from COVID-19. And so I think of this differently than what some other individuals might think about, right? When we're just watching the news sometimes and we don't feel the direct impact, sometimes we respond a little differently. But in this moment of COVID-19 and also seeing police brutality, is like I couldn't sit on it anymore. So one of the things that I did is I was like, I have to call on those who proclaim to be religious freedom advocates to think about these issues intersectionally. And that's one of the things that I'm happy to say, and I'm proud to see that with Americans United, is that Americans United has found ways to look at these issues intersectionally. Like Maggie talked about, you know, the things that happen to LGBTQIA community members. So when you think about that, people might be like, okay, you're talking about gay, lesbian, but yeah, there are people of color that are impacted by that. You have people from many different religious traditions and none that are impacted by that. If you just want to look at that particular issue, right? But then when you also talk about public schools, which Maggie mentioned, is when you're talking about public schools, like public schools are open for everyone, right? And no matter what you believe or not, it's for everyone. And so, yeah, public funding should go towards public schools. And so there's impact when you're looking at these issues. And so as someone that often calls on religious leaders to really rally around these issues, I think it's so important that we think intersectionally about this. And in this moment, again, of this pandemic that is impacting communities of color significantly. When a few weeks ago, I read an article that talked about how First Nation people, they were providing care in their area, and they asked for the tools, testing kits and everything to make sure that their communities could get the medical assistance that they need. They were sent body bags. So when you think about those things that are happening, when you think about how water is being polluted in certain areas that impact, again, First Nation people, then we need to, again, think intersectionally about these issues that impact all of us. And so religious leaders have again, I can't say it enough, a moral responsibility to think about this, to reimagine sacred space, to figure out how do we hold each other in care in this moment. And it's really difficult, right? It's really difficult in some ways. If you're like me, I'm a hugger, right? But I love my life, and so I'm not going to be hugging everyone in this moment. I'm going to socially distance. When we go walking, I wear a mask. When I go to the grocery store, I wear a mask. I follow the guidelines. If they say this is a one-way aisle, Sabrina Dent is going to go one way, because at the end of the day, for me personally, I have a child that is looking to me and to take care of him and to really take care of my community. And also, I wouldn't want my actions to have negative implications on other people that I love. And so I think it's so important that we think critically about this moment and read, like, there are many resources. And I want to go back, this is the last thing I'm going to share at this moment, but I want to go back to piggyback on something that Maggie said. If you go to the Americans United website, it's au.org, there is a resources page where there are lots of resources that talks about religion in public schools. It touches on the school vouchers. It talks about even how a lot of people proclaim that America is a Christian nation when it's not. So there are a lot of resources that are available. But also, one of the things that Maggie mentioned is that she said, come to us if there are issues. If you go to the legal page, there is information about how you can report a violation. And so there are resources that are available to assist people. They just need to know where to go.
I think knowledge is always power. And that's one way we will also combat this pandemic, as well as some of the social injustice that is occurring in our nation.
Yeah. I think that leads right into more questions about, for faith leaders, what are the moral issues and concerns that, in addition to what we've already shared, what other moral issues do you think faith leaders need to be thinking about? We've talked about, some of the realities in terms of thinking intersectionally, right? Not thinking, segmenting our work and our understanding of theology and religion and what it is we think we're doing each gathering, right? When we have our worship services. But what are some of the other moral issues that actually COVID-19, the pandemic has kind of either exposed or made even more exacerbated for us? And Maggie, let's start with you, if maybe you would want to share something.
This is the hardest one for me, as someone not haven't gone to theology school or anything. I could make jokes about how we're not taught morals in law school, but not true. I'm just kidding.
We hope you are.
I just figured I'd make a lawyer joke about myself.
Okay.
My mother actually was very excited the other day, and she sent me the letter that my church that I grew up with sent out, saying, President Trump said we're supposed to open and we aren't opening, again, not opening, but for mass gatherings. And he really did talk about, one, it was great, he talked about science, which I was really excited about, the pastor, but also talked about the vulnerable people in the community at the church, and about how there are ways to do this work outside the church. So I'm actually saying a lot of things that everyone else has already touched on. So I think that's one of the things, is thinking about others and thinking about other ways to do it. And then sort of touching on it's kind of the intersectionality, but a lot of the issues that we're seeing at the heart of it, it does come back in many ways to church-state separation. In part, if you're thinking about who's pushing this agenda, right? Like, who is pushing the mass gathering opening? Who is pushing the vouchers? Who is pushing the discrimination against LGBTQ people? Who is pushing the religious freedom really means you can discriminate stuff? It's really a particular religious group. It is the Trump administration's base, and that is why they are getting so much right now. And I think sometimes people will think, well, the church-state separation issue isn't, like, there are bigger issues that are like in my face, right? Like, there are people dying whether it is, again, by the police or by the virus. But sometimes when you take a step back and you look underneath this, if actually, Sabrina, you should speak to this, not me, but you pushed out a poll on Twitter the other day, and it was essentially like the same people who believe that we're a Christian nation also believe that, white nationalism. And so there's a real tie there. And so I think sort of connecting those dots and realizing that speaking up for church-state separation actually impacts those other things, I think is really important. So actually, I didn't go further than your question. I kind of repeated things, but I'll leave it there.
Right. But Maggie, I mean, what you're talking about is Christian nationalism, right? Christian nationalism, which is the same in many cases as white supremacy. And so these issues should not be ignored when we're talking about religious freedom. We have to look at those. Yes. We have to call out those individuals that sit silently on the sidelines and do not address these issues, because again, they come up in many of the issues that we've already talked about. Also, one of the things that I think about when I think about this question, Dr. Harris, is I think about the fact that every religious tradition and none has some version of the golden rule, right? It goes back as far as 1 million BCE, before Common Era, when hunters realized that in order for us to survive, we have to come together and we have to care for one another. And so when you think of the basis of this whole situation that we're all in, and Robert mentioned this earlier, is that it's human dignity, right? We have to come together around issues of human dignity. What does that look like for Sabrina? What that looks like for me is that if I'm going to speak, I have to speak out about police brutality. I have to speak out against the disparities that impact communities of color when it comes to healthcare, when it comes to access to jobs and transportation. But it also means I have to speak out on issues as far as immigration. That means when the Muslim ban came out, like, we need to rally together and speak out about this issue, because one of the things that you'll find is that Muslims are comprised of many different identities, right? There is a very diverse community of individuals. And so we have to speak out on these issues, and we cannot be silenced. When we're talking about, one of the things that I celebrate is the work of the Poor People's Campaign. I watched their rally the other night, and so again, they centered the conversation around the Navajo Nation and the impact of what's happening with Navajo First Nation people. And so there's a moral responsibility to speak out on all these issues, again, that intersect, and not see this as segmented. Like, we sometimes we compartmentalize things, but then there are times that we have to say, oh, you know what? That connects because of this particular issue. And so one of the things that Maggie was saying is that I raised the question. I was like, if you're talking about this, right? If you're saying that, for example, if you're saying that all lives matter, then you have to recognize that Black lives are a part of the All Lives Matter. You have to recognize that Native people are a part of that conversation. You have to recognize that Asian Americans, who have been also targeted during this time, during COVID-19 for various reasons. I mean, I've read stories where children were targeted, Asian children were targeted. We have to speak up about these things. Anybody that looks at my social media timeline will see I will raise awareness on any issue, because if it affects the human dignity of a person, it is a problem for me. And so for me personally, if we don't speak up about these things, right, then many organizations that say they care about human beings, that they care about these issues, then really become hypocrites of their own missions when they don't speak out, when they don't do the work. And so one of the things that we want to make sure at Americans United is that we're doing that we're supporting communities, that we're really taking a stand on church-state issues, because it's really important. And it gets complex at times, especially, you know, I'm not an attorney, but even when you're talking about the stimulus bill, when you know that there are communities that are struggling financially, that have lost financial resources because they have been closed, but at the same time, we're like, you don't want your hand in the government's pocket. So it's like, these are the things that we must think about.
Well, it brings to to my memory, and I'm sure to many, the voice of our fallen brother Martin Luther King Jr., who's often repeated that injustice anywhere was injustice everywhere. And so to attempt to work on or to speak out against an injustice that is only important to my community, my family, my concern, is to actually ignore the reality that justice is a human issue, right? And it's an issue that addresses what it means to be human, to be fully human, and to be able to actualize our humanity together and apart. Robert, did you have anything more that you wanted to share around this this topic of our moral responsibility as faith leaders?
Well, I think our moral responsibility is also, as you said, and as these ladies before me have already so eloquently said, that we must, think globally, that we can't forget that outside of our faith community, outside of our tradition, outside of our own ethnic community, there is still a moral majority that is suffering like everyone else. Unemployment affects everyone, and we're at about 20 to 21% of it. Poverty affects everyone. The lack of healthcare affects everyone. Homelessness affects everyone. So these are issues that we must keep at the forefront, that we cannot wait until it happens to us to make it our problem. I think we need to be proactive. I think we need to keep it at the forefront, and we need to speak about it openly and not be afraid to step on toes, religiously or socially. I think sometimes, things can be clarified. People can be understood once you really step, for a second in their shoes and down their road and their path. So I think that, for faith leaders, we must come together in the sense of uniting all people, not just our own congregations, but we must unite, our communities, because right now it will be our communities that will suffer, for the injustices of, as we see some cities burning. It'll be the communities that are burnt that are most likely going to be, in need of all of the services that are being torn down and destroyed. So, coming together and unifying, I think right now is got to be the biggest moral push that we all place on each other, and recognizing the plight of each other, and making that kind of, our job one for each place of worship.
As we are kind of winding down our discussion, I want to, we've already talked about some of the resources. I think Sabrina and Maggie shared that there are resources on their website. Do you want to give that website address again, just so that our participants can get it?
Sure. You can visit au.org for Americans United for Separation Church and State. There are lots of resources that are on there. You can see the team members that Maggie talked about earlier that are doing this tireless work. I mean, people are up at 2 a.m. watching, for SCOTUS decisions and writing amicus briefs. And so it's important to know that who's advocating on behalf of everyone to protect our rights, our rights to freedom of conscience and belief.
And Robert, I know you suggested that the CDC's guidelines are important, critical, and good. Do you have other suggested resources that faith leaders can access?
Well, first and foremost, I think we can't forget, as I said, the CDC, which is cdc.gov. In my state of Virginia, or for those who may be in Virginia, the Virginia Department of Health is another great resource, because they have testing that is available, and they have, hours that are pretty reasonable throughout the week. They're nothing on the weekend. Usually then you'll have to go to your hospitals in order to gain testing for coronavirus. But for those who are in need of mental health issues or maybe going through mental struggles, I think that, also people ought to remember to reach out to each other. And I think that, we've got to stay well connected with each other. We've got to call and check on each other, and make sure that we are happy, healthy, and heard, and all of those attributes that will come with that. So, those are the things that I definitely think, as church community leaders, we must remember. We must also remember, some of the resources that are in our community. Like in every community, 911 is an emergency call number. I believe 211 is also an emergency call number for any type of crisis that is going on as well. So, remembering all of, the things that are already still in place. And obviously we don't want to overrun them or overwhelm them, as we don't want to overwhelm our ERs, our hospital ERs, and our medical community with virus or infection by continuing social distancing, wearing our PPE, and continuing hand hygiene. So those are the things that I feel, we definitely need to take away from this today.
I want to suggest a resource for clergy to consider. It's a resource that I have students read in the systematic theology course when I teach it. The title is Emergence Christianity. While it is a book about how Christianity has changed and transitioned, it also kind of takes into account the realities of technology and virtual opportunities and suggestions for how communities of faith can continue to expand their outreach, and to, particularly in this time of pandemic and houses of worship being closed and having limitations of how they can meet. I think it could be a very helpful resource. It's not really, I would say, even whether you're Christian or not Christian, don't let the title dissuade you from looking at it, because it has some really good information. And the title, the author is Phyllis Tickle. So I want to encourage that. As well, we're going to wrap up now, but if there are questions that any of our guest attendees have, please send them to my email, and I will get them to our panelists, and we will be able to get responses to you. This is our first Zoom webinar, and I'm still learning the platform, and so I think I did something that prevented me from being able to open it up for questions, and I sat here the whole time trying to figure it out and never did figure out how to fix it. So but we will do better next time. I am so very grateful to our panelists for being here today, taking the time. Thank you, Dr. Robert Hill, for your wisdom, your expertise, and for your lovely, lovely background. Love that purple. That's one of my favorite colors. That's just gorgeous framing. You did a great job there. And just thank you so much for being here today. For Dr. Sabrina Dent, we want to thank you. I thank you also. I appreciate all the great wisdom and good insight and your passion, and you've been doing this work for a good while now, and we can see why you are the expert that you are. And so thank you so much for your, and Sabrina and Robert both are, we can claim them in some way because they have come through Virginia Union Seminary. So we, that's right. So we do claim them. Maggie, we might be able to get you here somehow. I don't know. But Maggie, thank you so much. Maggie Garrett, thank you so much, Esquire. Thank you for your expertise and your legal, sharp legal mind, and for helping us to think about this in ways that I think will be very helpful to our faith leaders to really dig into those legal concerns that maybe they weren't aware that that were out there. So thank you so much.
And
Again,
thank
I thank the attendees for being here today. And again, please, my email is fbharris@vuu.edu. Please send me your questions. I will get them to our panelists and ensure that you get answers. Is there anything that you would like to say? I'll open it up for each one of you to share a closing thought.
Yes. Dr. Harris, I just want to say thank you to you and the Samuel DeWitt Proctor School of Theology for taking this moment to have this critical discussion and to really seeing the importance of religious leaders understanding why we advocate for religious freedom the way that we do, and why it's important for us to engage in this conversation, especially when we think about historically African Americans and people of color were not considered when religious freedom when the founder framers were framing this beautiful document. And I say beautiful document because it made it so that we all have the right to the freedom of religion and freedom of conscience right now. But I think it's so important that seminaries get engaged in this discussion, and that we keep these conversations going, and that we ask healthy questions and have a healthy sense of curiosity. And so I appreciate that you and Dr. Howard took the moment to say, let's make this happen. So thank you.
Thank you. Maggie, do you have a few words you'd like to share? You have to unmute yourself.
Yep.
There you go.
Yeah, I don't know how I can say anything better than Sabrina just said, but yeah, thanks for including me. You know, these are issues that I care so much about, and the legal nerd in me finds fascinating, but they also have real world implications, and you know, if people have questions, I'm happy to answer them, and whether it's about this particular issue or about any issues that are happening, Congress in your state, whatever, that affect somehow religious freedom, church-state separation, whether it's prayer in school or vouchers or using religion to discriminate, any of those things. I think it's so important to engage faith voices and leaders in those issues, because it is often portrayed as a religion versus secular issue when it isn't. Again, I learned all about this from my pastor as a kid. And so I just appreciate the opportunity to speak to all of you. Thanks.
Robert, please.
Dr.
Sure.
Harris, I just want to thank you and the STVU and all of our family there at Virginia Union for allowing us to come forward and have this discussion. I do think that, you know, without conversations like this, none of us will ever grow, and we need to learn. We need to be lifelong learners and grow, not only in our beliefs, but also in our understanding. So, you know, thank you for having me. Thank you all for allowing me to share the panel with you. I am honored to be in the presence of these wonderful ladies. So thank you, ladies, for all that you do every day for our community and for our nation.
Yeah, so thank you all again. And to the end, to kind of pick up on some of the things that Sabrina mentioned, Sabrina has recently come to AU, but we have partnered together over the last couple of years on these issues around religious freedom. And we have a course that Sabrina was very instrumental in putting together and offered with the Museum and the Religious Freedom Institute of the Museum. But that course will now be held here at Virginia Union at the seminary, and we will offer it in January. And so for those of you who are attending and are interested in knowing more and learning more about religious freedom, please look for that, for information to come out about that soon, as well as the possibility of, not only the possibility, but we are also working on a concentration in these issues, religious freedom and these issues. And I think some would ask, again, why would African American people, why would Black people be interested in religious freedom? Isn't that a white, white evangelical issue? And the answer to that is, something that I said, and I thought about, and the way that I think about this is that when we think about how this nation, colonialism, settler kind of movement around the world, around the globe 500 years ago, it started as a religious oppression of people around the world, right? Where the church, the Catholic Church at the time, decided that it was important and necessary to go out into the world, to give authority to explorers, to go out into the world and to convert, right? Eradicate or subdue anyone who was an so-called infidel. And so we, the people that are sitting here with brown skin, Black people, Native peoples, peoples from South America, and who were living in South America, the Native populations, as well as the African peoples, were whose lives were ever changed, right? Because of that religious idea. And so that's, for me, the reason why African Americans ought to be concerned about religious freedom, because it is how we got here. The question of who gets to decide what is true, right, and good for humanity to believe, and how one practices their understanding of the world and how they engage the world. Was decided for generations. And so we are engaging this conversation because it's important to all of us. And so thank you again for being here this afternoon. Next time we have a webinar, we'll be better at knowing how to manage it. And again, thank you all, and we hope to see you on the other side.
Thank you.
Thank you.
Yes.
Bye.
Keep
Thank
us
you,
in
Robert,
prayer.
for your work. Thank you, Maggie.
Thank
And
you
be
all.
safe, Robert. Thank you.
Thank you.